recent years, Kenya has made huge strides in tackling HIV/AIDS epidemic and is widely regarded as one of the sub-Saharan Africa's success stories. However, the HIV transmission burden still remains a challenge to deal with, even as the country aligns to the global target of ending the epidemic by 2030 by achieving 95% testing of all people living with HIV, 95% of them put on antiretroviral therapy, ART, and 95% of those with ARV virally suppressed. With a HIV prevalence of 7.4%, a HIV burden of 54,600 persons, an annual HIV incident of 1,609 persons as per the National HIV and AIDS Estimates 2014, Mombasa County was ranked among the high HIV epidemic counties that need a turnaround. Strategic efforts and innovations focused towards county-specific programs were inevitable.
The role of now this phase of Afya Pwani was to improve and increase utilization of quality health services through strengthening service delivery and institutional capacities of the 5 counties of the coast. That is Lamu, Kilifi County, Mombasa County, Taita Taveta County, and Kwale County. But as you have realized, due to the terrorism that we had around 2018, USAID pulled out of Lamu.
When you look at Afya Pwani program, we are talking about the 90-90-90 or the 95-95 cascade, where we want to see that there's identification of all those who are living with HIV are identified within the community, are linked to our facilities. 95% of these clans to be retained in the facilities and also to achieve viral suppression among all these clans that we are talking about.
We were at 5.9, now we are slightly at 6.4, somewhere there. This increased right after we were affected by the pandemic.
Afya Pwani, a USAID-funded integrated health project under Pathfinder International, drew a roadmap and has been spearheading an increase to access and utilization of quality services for HIV by supporting the Mombasa County government's efforts towards elimination of pediatric HIV infections through provision of quality prevention of mother-to-child transmission of HIV, PMTCT services, scaling up prevention awareness, supporting HIV testing services, and journeying with mothers to ensure safe HIV-negative delivery at health facilities and postpartum care for the mother and the baby.
Under PMTCT, our main outcome was to reduce the rate of mother-to-child transmission of HIV. Basically, the vertical transmissions, whether during pregnancy, at birth, during breastfeeding, that cascade. We came in when the region had a high of close to 5.2% mother-to-child transmission of HIV. So as we speak right now, I'm proud to report that the project brought that down over the course of 5 years to a low of 2.8, 2.9%.
We of course have to start with the pregnant mothers. When you get a first-time mother who is pregnant and you do the ANC profile and you get a positive HIV client, that is where it all starts. We are getting referrals from the community volunteers who are supported by Afya Pwani currently.
Each CHV is assigned to 100 households. So within their households, they have to identify which mother is pregnant but haven't gone for any ANC profiling at the hospital.
Due to a number of innovative approaches supported by Afya Pwani Project, from Jua Mtoto Wako initiative that targets children, to promotion of self-testing initiatives between partners, HIV case management, Mombasa County is registering notable success in HIV testing, prevention, care, and treatment.
We had so many clients who had a very high viral load. So when Afya Pwani came in with the support from the county, Jua Mtoto Wako initiative was introduced. We introduced home visits by our mentor mothers or the peer educators that we have. Through that aspect, we've reached viral suppression to 100%, let me say, because all the kids that had high viral load are now totally suppressed.
Imemsaidia maana kulingana pia matumizi yake ya dawa ilikuwa si mazuri. Hata afya yake ilikuwa si sawa. Lakini kwa wakati huu afya yake ilikuwa sawa. Naona akiendelea ndoto yake ya kuwa daktari itatimika.
We realized that so many of them are devoting. We formed 12 CHVs in our facility. It means that they come for the drugs from the facility and then go to the community to give them.
Ina manufaa juu tangia siku yenye nilijua hali yangu nilikuwa na changamoto ya kwenda pale juu nilikuwa naogopa naweza pata mtu pale mwenye ananijua kuja niseme huku. Sasa ikifika huku pia naona kwa muda wangu umenisaidia juu ile time yenye ningeenda nayo pale naweza fanya nayo kitu kingine.
When the Afya Pwani came in, we have been able to rise, to be able to keep our data well. It has helped us to be able to reach to our clients, and we also end many supporting groups. PMCTC, then we end devoted tracing, then we end suppression, and at least we've managed to have over 90% of viral suppression in our clients due to the support we have been able to get from Afya Pwani.
The quantity issued during the month, it was 3. When we divide 6 by 3, we find they had 2 months of stock. So they have sufficient.
Under the auspices of the Commodity Security TWG, we were able to plan trainings about commodity management, tools like daily activity registers, the stock control cards, top-up cards in the lab. They are printed and supplied by the program.
Cases where KEMSA could only supply like 1 month drug, it was through Afya Pwani that provided the logistics for us to reach out to other areas to resource for this extra medications for our patients.
The ART coverage in most of our counties spans above 80%. We've been able to increase our linkage from a low of around 75% to now a high of over 90%. Our retention currently stands at above 90%. Our suppression rates, our closing year is at more than 90%, which is an achievement that we pride ourselves in.
HIV testing in recent years has embraced a more targeted approach where efforts have led to a dramatic rise in the number of people testing and knowing their HIV status.
Tulipatana kila mtu akiwa na maisha yake watu wazima. Niliweza kumweleza hali yangu na nikamwambia ni vizuri yeye pia aweze kujipima tuweze kuaminiana katika mahusiano yetu. Niliweza kuja kwa mhuduma wangu wa afya, nikamwelezea, akanipa ushauri na akanipatia self test kit. Akanieleza vile hiyo self test kit mtu anaweza kujipima akiwa nyumbani na kukiwa na jambo lolote naweza kuwasiliana na yeye. Niliweza kwenda na mwenzangu akaweza kujipima. Ninamshukuru sana kwa sababu huwa hanifichi. Tunajua hali yetu. Tumejua pia jinsi ya kujikinga. Mahusiano yetu yanaendelea vizuri na maisha yanaendelea sambamba.
After self testing unaweza kuja ili tukafanya management na tukaweza kukuweka kwa dawa, tukakushauri vile utaweza kuishi vizuri hata kama utakuwa uko na virusi.
Over the life of the program, we have roughly reached around 22,000 key populations, 16,000 female sex workers or thereabouts, to around 8,000 men who have sex with men, and about 500 transgender population. So targeting them with prevention, treatment and care helps a lot in terms of achieving the prevention agenda.
In Mombasa, Afya Pwani is supporting index texting, a partner-led model that is standing out to be a key innovation in the area of identification and contact tracing of HIV-positive cases.
If a client comes for HIV test, we try to identify how many sexual partners that person has ever had, whether he's very much ready to help us, or maybe he can give us the number so that we can be able to get in touch with the partners. Through that, we are able to reach sexual partners. Sometimes it goes down like a tree. Maybe you can get one who is HIV positive, and within that period also you talk to that person and also gives you another person. And in that way we are able to get many by testing very few.
Mombasa County's current HIV prevalence stands at 5.6% compared to 7.4% 5 years ago, a stride attributable to the success of, among others, Afya Pwani's dreams, or determined, resilient, empowered, AIDS-free, mentored and safe package of prevention interventions that targeted adolescent girls and young women.
Kwenye Afya Pwani Dreams kulikuwa na lessons kama za PrEPs, mambo na life skills, GBV, condom education, sugar.
We are Fast Achievers!
Hiyo project ilikuja kuempower girls, kumpea masomo ya maisha, mambo ya HIV and AIDS, menstruation, entrepreneurship, kila kitu. Tukakuja tukakutana safe space, ndio sisi wasichana tukaamua tukae chini tuanzishe hichi chama ili tujiendeleze sisi kama wasichana. Afya Pwani wakaamua watu sponsor kwenye kutuanzishia mradi, na tukanunuliwa tent, tukanunuliwa na sufuria 2 zile maregedi kubwa za kupikia, viti 68, tukanunuliwa na sahani. Kwa hiyo ile tunakodisha sisi, ile pesa pewa.
Yafaa wewe mwenyewe kwanza ujisupport wewe kama wewe, ndio mwingine ajue enyewe huyu yuko serious na anataka kufanya kitu, ndio naye pia akusaidie. Kama vile sisi na Afya Pwani tulianza sisi kama sisi, ndio Afya Pwani wakaona yenyewe our girls wanataka boost, ndio wakatu boost.
The goal of Dreams Project is just prevention of new HIV infections among adolescent girls and young women. As at March 2021, we had a target of 29,987 girls, of which we've been able to reach around 28,226. We have quite a number of interventions that we give to them. These interventions involve biomedical interventions, we have structural interventions, and we have behavioral interventions, just to help them to be able to access and to make informed decisions about their sexually reproductive health.
Tunaisambaza kwa wasichana wengine kwa sababu sisi tulisoma hivi HIV and AIDS prevention ni hivi. Mtu ili akiwa na ukimwi ana find counseling, atumie dawa zake, asikose kutumia dozi. Sasa sisi kama ambassadors to pass the message to other girls in the community, at least au pia wakuwe na ile knowledge.
Majority of them have come up with testimonies, being able to change, get into economic empowerment activities, so they're able to generate income to support themselves.
Since its onset, Afya Pwani's focus has not only increased access to and utilization of HIV services across the coast counties, but also helped strengthen county health systems like the management of health record.
Before it could take even more than a week, of which when it comes to reporting, you are supposed to submit the data before 5th of every month. So we had to apply a lot of manpower, which is costly compared to now. It has helped us to save time. 2, it's most effective now that maybe even another generation, as long as we have the backup, you can access it even for years.
Initially, when we wanted to get reports, it took time. It took many people sitting together and coming up with that report. Going to raise so many registers and books to be able to generate that report. But with now, just with a click of a button, we can be able to generate that data.
Quality data, it translates to quality programming. So through the EMR, you are able to easily identify upcoming challenges.
We've been able to do as per the work plan that we had, and we can pride ourselves as a partner to MOH.
The faces that we saw are faces full of expectation, people in need of quality HIV services, people who are really worried about their healthcare, expectant faces, so to say. As we live, I think we are living people who are happy, I must say, who have enjoyed the level of quality that we have brought to HIV programming. We also leave behind counties that are resilient, have taken a bit more of ownership of HIV programming on board, and are willing to show much more leadership.
With more girls being empowered, I'm seeing
girls who are able to empower their fellow girls.
The key is APNS, Assisted Partner Notification, period.
Much has been done, much has been achieved, and a sustainable infrastructure created for the posterity of the services.